This lecture is on neoplasia. I am Dr. Janice Williams, and I will be introducing you to the pathophysiology of neoplasia. When we utilize the term neoplasia, neoplasia is a broad term that covers not only malignant neoplasia, but also benign neoplasia. In this lecture, we will talk about and we will compare both benign and malignant neoplasia. We will talk about the pathophysiology for both. Let's get started. Let's first start with talking about what are the objectives that we will cover in this lecture. The objectives to be covered in this lecture are multifaceted. Please take the time to read each objective. As you listen to the lecture, identify the content being discussed with the objective that is outlined here. Utilize your textbook and other resources to enhance your knowledge related to the pathophysiology, related to how we treat, how we assess, how we educate, how we stage both benign and malignant neoplasia. So let's talk about the difference between a benign neoplasia and a malignant neoplasia. Benign neoplasia refers to the growth of abnormal cells that do not invade nearby tissue or spread to other parts of the body. These cells typically form a localized mass or tumor, but they do not pose a significant threat to the overall health and can often be easily removed or treated. Whereas malignant neoplasia, which is also referred to as cancer, refers to the growth of abnormal cells that have the ability to invade nearby tissue and spread to the other parts of the body through the bloodstream or lymphatic system. Malignant cells can form tumors, but they can also infiltrate surrounding tissue and organs, causing damage and potentially leading to life-threatening complications. If you look at the picture on this slide, you can see on your left benign lymphoma. If you look here, you see how that mass is encapsulated and it just affects that area. Whereas if you look at on the right, and I'm going to do that one in yellow, what a malignant tumor looks like, you can see how it invades other areas. So that is a visual of the difference between a benign and a malignant neoplasia. Let's talk specifically about some characteristics of cancer. Cancer is characterized by several key features. These features include, first, uncontrolled cell growth. Cancer cells divide and multiply uncontrollably, forming a mass of abnormal cells called a tumor. Cancer also invades and metastasizes. Cancer cells have the ability to invade nearby tissues and organs, infiltrating and damaging them. They can also break away from the primary tumor and spread to other parts of the body through the bloodstream or lymphatic system, forming secondary tumors in a process called metastasis. Third, cancer can also have angiogenesis. This is when cancer cells stimulate the growth of new blood vessels to supply nutrients and oxygen to the tumor, ensuring its continued growth and survival. Fourth, they also have genetic mutations. Cancer often arises due to a genetic mutation or alteration in the DNA of cells. These mutations can disrupt normal cell functions, leading to uncontrolled growth and division. Also, cancer can cause the loss of cell cycle control. This is when cancer cells lose the ability to regulate their cell cycle, leading to uncontrolled proliferation. They also may invade programmed cells and cause death, apoptosis. allowing them to survive and accumulate. They can also have abnormal cell morphology. Cancer cells often have abnormal shapes and sizes compared to normal cells. They may have enlarged or irregular nuclei, increased nuclear to cytoplasmic ratio, and other structural abnormalities. Cancer cells can also have immune system evasion. This is when cancer cells can evade detection and destruction by the immune system, allowing them to continue to grow and spread. It is important to note that not all tumors are cancerous. Some tumors may be benign, meaning they do not invade nearby tissues or spread to other parts of the body, as we saw in the previous illustration. However, malignant tumors have the characteristics described and are considered cancerous. Tissue renewal and repair involves several components, including cell proliferation, cell differentiation, and apoptosis. Cell proliferation is when tissue renewal and repair require the proliferation of cells to replace damaged or lost cells. Proliferation involves the division of existing cells to produce new cells. This process is regulated by various signaling pathways and growth factors. Whereas cell differentiation is differentiation referring to the process by which cells become specialized and require specific functions. In tissue renewal and repair, newly generated cells need to differentiate into specific cells, specific cell types, to replace the damaged or lost cells. This process is regulated by various molecular cues and signaling pathways. Apoptosis, also known as programmed cell death, plays a crucial role in tissue renewal and repair. It is a highly regulated process that eliminates damaged or unnecessary cells. Apoptosis helps in maintaining tissue homeostasis by removing old or dysfunctional cells and allowing the replacement with new cells. These components work together to ensure proper tissue renewal and repair. Cell proliferation provides a sufficient number of cells. Cell differentiation ensures the generation of specialized cell types, and apoptosis eliminates the unwanted or damaged cells. Let's talk now about the phases of the cell cycle. The cell cycle consists of several phases. It includes the interphase and mitosis. Interphase is further divided into 3 phases: G1 phase, S phase, and the G2 phase. Mitosis is divided into 4 phases: prophase, metaphase, anaphase, and telophase. Let's start talking about the G1 phase, or the gap 1 phase. This is the first phase of interphase, where the cell grows and carries out its normal function. It prepares for DNA replication and checks for any DNA damage or errors before entering the S phase. The S phase, also known as the synthesis phase. In this phase, the DNA replication occurs. The cell synthesizes a copy of its DNA, resulting in the formation of sister chromatides. Each chromatide contains an identical copy of the genetic material. In the G2 phase, or the gap 2 phase, after DNA replication, the cell enters this G2 phase. During this phase, the cell continues to grow and prepares for cell division. It checks for any DNA damage or errors and ensures that all necessary components for cell division are present. In mitosis, mitosis is the process of cell division, where the duplicated chromosomes are separated into 2 daughter cells. It consists of 4 phases. the prophase, which is when the chromatin condenses into visible chromosomes and the nuclear envelope breaks down. The centrosomes move to opposite poles of the cell and spindle fibers start to form. In the metaphase, the chromosomes align at the center of the cell. This is known as the metaphase plate. The spindle fibers attach to the centromeres of the chromosomes. In the anaphase, the sister chromatids separate and are pulled toward opposite poles of the cell by the spindle fibers. This ensures that each daughter cell receives an identical set of chromosomes. In the telophase, the separated chromosomes reach the opposite poles of the cell. The nuclear envelope reforms around each set of chromosomes, and the chromosomes begin to decondense. The cells start to divide, leading to cytokinesis. Cytokinesis is the final stage of the cell cycle. This is where the cytoplasm divides, resulting in the formation of two daughter cells. In animal cells, a cleavage furrow forms, and the cell membrane pinches inward to separate the two cells. In the plant cell, a cell plate forms in the middle of the cell and eventually develops into a new cell. After cytokinesis, the two daughter cells enter the G1 phase, and the cell cycle starts all over again. The next two slides that you will see gives you a written image of what I just discussed. The body is composed of various types of cells that can be categorized into like four main groups. We have epithelial cells, connective tissue cells, muscle cells, and nervous system cells. These categories of cells work together to maintain the structure and function of the body. Each cell type has its own unique characteristics and functions that contribute to the overall health and well-being of an organism. Cancer, however, has a significant impact on the cell types in the body. It is a disease characterized by uncontrolled cell growth and division, leading to the formation of a mass of abnormal cells called tumors. Cells can affect various cell types and tissues in the body, disrupting their normal structure and function. An example of this is when you have abnormal cell growth. The cancer cells divide and grow uncontrollably, leading to the formation of a tumor. These cells do not respond to the normal signals that regulate cell growth and division. As a result, the affected cell type loses their ability to regulate their growth and become abnormal. Cancer can also cause the loss of specialized functions. Cancer cells often lose their specialized function and characteristics. An example of this is in the case of epithelial cells, which normally provide protection and lining to organs. Cancer cells may lose their ability to form a proper barrier, leading to tissue damage and dysfunction. Cancer can also disrupt the tissue's architecture. Cancer cells can disrupt the normal architecture and organization of tissues. They can invade surrounding tissues, disrupt the connections between the cells, and alter the extracellular matrix. This disruption can impair the normal functioning of the affected cell types and their tissues. Cancer can also impact the interface with normal cell communication. This is done by cancer cells interfering with the normal communication between the cells. They produce abnormal signaling molecules or receptors that disrupt the normal signaling pathway involved in cell growth, differentiation, and apoptosis. This interference can further contribute to the abnormal behavior of the affected cell types. Overall, cancer has a profound impact on cell types in the body, leading to the abnormal growth, invasion, loss of specialized function, disruption of the tissue architecture, and interference with normal cell communication. These effects contribute to the progression and spread of cancer and can have severe consequences for the affected individual's health and well-being. Stem cells are a unique type of cell that has the ability to differentiate into various specialized cell types in the body. They are characterized by their self-renewal capacity, which means that they can divide and produce more stem cells, as well as their potential to differentiate into different cell lineages. There are two main types of stem cells. We have embryonic and we have adult stem cells. Embryonic stem cells are derived from embryos at the blastocyte stage. This is typically around day 5 to 7 after fertilization. Embryonic stem cells are pluripotent. This means that they have the potential to differentiate into cells of all three germ layers: the ectoderm, the endoderm, and the mesoderm. They can give rise to any cell type in the body. Stem cells can also be adult stem cells. These are also known as somatic or tissue-specific stem cells. These stem cells are found in various tissues and organs throughout the body, such as the bone marrow, the skin, your brain, and liver. Adult stem cells are multipotent, or sometimes referred to as unipotent. This means they have the ability to differentiate into a limited number of cell types within their tissue or organ. An example of this is hematopoietic stem cells in the bone marrow. They can differentiate into various blood cell types, while neural stem cells in the brain can give rise to different types of neurons and glial cells. Stem cells play a crucial role in the development, growth, and tissue repair of the body. They have the potential to replace damaged or lost cells and contribute to tissue regeneration. So, what is the impact of cancer on stem cells? Cancer can have both direct and indirect impacts on stem cells in the body. Some of the ways this can happen is through transformation of the stem cell. Cancer can arise from the transformation of normal stem cells. When a stem cell undergoes genetic mutations or epigenetic changes, it can lose its ability to regulate cell growth and differentiation, leading to uncontrolled proliferation and the formation of a tumor. This transformation can occur in both embryonic stem cells and adult stem cells. Cancer can also cause disruption of the stem cell niches. Stem cells reside in specialized microenvironments called stem cell niches, which provides the necessary signals and support for their self-renewal and differentiation. Cancer cells can disrupt these niches, altering the normal interactions between stem cells and their surrounding cells. This disruption can affect the balance between self-renewal and differentiation of stem cells, potentially leading to abnormal stem cell behavior. Cancer cells can compete with normal stem cells for resources and space within the tissue. This competition can disrupt the normal functioning of the stem cells and their ability to regenerate and repair tissue. Cancer cells may outcompete normal stem cells, leading to a decline in tissue regeneration and repair capacity. Cancer cells can also induce the stem cell-like properties. Some cancer cells acquire stem cell-like properties, known as cancer stem cells or tumor-initiating cells. These cells have the ability to self-renew and differentiate into various cell types within the tumor. Cancer stem cells are thought to play a role in tumor growth, resistance to therapy, and metastasis. Their presence can complicate cancer treatment and contribute to disease reoccurrence. Also, cancer can impact the tissue regeneration. Stem cells are crucial for tissue regeneration and repair. Cancer can disrupt the normal functioning of stem cells, impairing their ability to regenerate damaged tissues. This can lead to impaired wound healing, tissue dysfunction, and compromised organ function. Understanding the impact of cancer on stem cells is important for developing effective cancer treatments and strategies for tissue regeneration. Targeting cancer stem cells and restoring the normal function of stem cells within tissue are areas of active research in the field of cancer biology and regeneration medicine. Let's now talk about tumors specifically. When talking about tumors, we classify them as either benign or malignant. Benign tumors are tumors that grow slowly and have well-defined borders. They don't have the ability to spread to other parts of the body, and they consist of cells that closely resemble normal cells in terms of structure and function. The cells in benign tumors are well differentiated and organized. Whereas when you think about malignant tumors, these tumors grow rapidly and can invade surrounding tissues, infiltrating and damaging nearby structures. They have the potential to metastasize, which means break away and enter the bloodstream or lymphatic system and establish secondary tumors in distant organs or tissues. And malignant tumors also may display features like rapid division, loss of differentiation, and abnormal genetic changes. When we think about the treatment and prognosis of malignant versus benign tumors are usually treated by surgical removal, and they have a low likelihood of recurrence after complete removal. Whereas malignant tumors often require a combination of treatments. It could include surgery, chemotherapy, radiation therapy, targeted therapy, or immunotherapy. It is important to note that while benign tumors are generally not cancerous, they can still cause significant health issues depending on their location and size. Therefore, regular medical evaluations and monitoring are essential to ensure the appropriate management of both benign and malignant tumors. Tumors can be classified into various types based on their origin, cell type, and characteristics. Tumors can be classified as carcinomas. Carcinomas are tumors that originate from epithelial cells, which are the cells that line the surface and cavities of organs and tissues. Carcinomas are the most common type of cancer and can occur in various organs, including the breast, lung, colon, prostate, and skin. Whereas sarcomas are tumors that arise from connective tissues such as bone, muscle, fat, and cartilage. They can occur in any part of the body and are less common than carcinomas. Some examples of sarcomas include osteosarcoma, which is bone cancer, liposarcoma, which is fat tissue cancers, and leiomyocarcinoma, which is smooth muscle cancers. You can also have lymphomas, and lymphomas are tumors that develop in the lymphatic system, which are a part of the immune system. They typically arise from lymphocytes, a type of white blood cell. Lymphomas can be classified into two main types, Hodgkin's lymphoma and non-Hodgkin's lymphoma. These are just a few examples of the many types of tumors that can occur in the body. Each type of tumor has its own unique characteristics, treatment, approaches, and prognosis. Proper diagnosis and classification of tumors are crucial for determining the most appropriate treatment options and management strategies. As mentioned in the previous slide, when we think about benign neoplasms, these are our slow progressing tumors. They can have an expansive manner of growth. They do not metastasize and usually are well differentiated. Whereas our malignant neoplasms tend to be fast growing, they can potentially kill regardless of where they are originated from. They usually tend to encompass some blood vessels, and they rob the normal tissue of their essential nutrients. And they can liberate enzymes and toxins that can destroy tumor tissue and normal tissue as well. So as mentioned earlier, when we differentiate benign from malignant, usually the characteristics of the cell, the rate of growth, how they grow, their potential for metastasizing, do they cause damage to other tissue, and their capacity to cause death are some of the differentiating factors between malignant and benign tumors. Cancer cells can exhibit a range of differentiation states, which can be categorized into three main types: well differentiated, moderately differentiated, or poorly differentiated. Well differentiated cancer cells closely resemble normal cells in terms of their structure and function. They retain many of the characteristics of specialized functions of the tissue from which they originated. Well differentiated cancer cells tend to grow more slowly and are often associated with a better prognosis. Whereas moderately differentiated cancer cells exhibit some degree of abnormality in their structure and function. They may have some features of normal cells, but also display certain characteristics of cancer cells. The degree of differentiation can vary within the tumor, with some areas showing more differentiation than others. The last, which is poorly differentiated or undifferentiated cancer cells, bear little to no resemblance to normal cells. They often have abnormal structures, irregular shapes, and lack of specialized functions. These cancer cells tend to grow rapidly and are associated with a more aggressive behavior and poor prognosis. The degree of differentiation of cancer cells is an important factor in determining the aggressiveness of the tumor and its response to treatment. Well differentiated tumors are generally less aggressive and may respond better to treatment, while poorly differentiated tumors are more aggressive and may be more resistant to therapy. We can assess the differentiation of cancer cells through microscopic examination of tumor samples. This is where the pathologist evaluates the appearance and characteristics of the cancer cells. It helps to determine the tumor grade, which is a measure of how closely the cancer cells resemble normal cells and how aggressive the tumor is likely to be. Understanding the differentiation status of cancer cells is crucial for guiding treatment decisions and predicting the behavior of the tumor. It also helps to determine the most appropriate treatment approach and assessing the prognosis for your patient. What are the methods at which cancer spreads? Cancer can spread from its original site to other parts of the body through a process called metastasis. There are several methods by which cancer cells can spread. It can spread by invasion. It can spread by lymphatic spread, hematogenous spread, direct seeding, transoelomic spread. The spreading of cancer is a complex process that involves multiple steps, including the ability of the cancer cells to invade surrounding tissue, enter the blood or lymphatic vessels, survive in circulation, and establish secondary tumors in distant organs. The specific mechanisms of cancer spread can vary depending on the type of cancer and its characteristics. Several factors can influence tumor growth and progression. Here are some key factors: genetic mutations, play a significant role in the development and growth of tumors. Mutations can occur in genes that regulate cell growth, division, and death, leading to uncontrolled cell proliferation and tumor formation. These mutations can be inherited or acquired during a person's lifetime due to various factors such as exposure to carcinogens, radiation, or errors in DNA replication. Another factor is angiogenesis. Tumors require a blood supply to receive oxygen and nutrients for their growth. Also, the immune system response. The immune system plays a crucial role in recognizing and eliminating abnormal cells, including cancer cells. Cancer cells can develop mechanisms to evade immune detection and destruction. Tumors can create immunosuppressive microenvironments that inhibits immune responses, allowing them to grow and evade immune surveillance. Another factor is hormones. Some tumors are hormone dependent. It means that their growth is influenced by their hormones. Another factor is the tumor microenvironment. The tumor microenvironment consists of various cells, molecules, and structures surrounding the tumor. It includes immune cells, fibroblasts, blood vessels, and extracellular matrix components. The tumor microenvironment can promote tumor growth by providing growth factors, promoting angiogenesis, and suppressing the immune response. Lifestyle is also a factor. Certain lifestyle factors contribute to tumor growth. This can include tobacco use, excessive alcohol consumption, poor diet, lack of physical activity, exposure to environmental carcinogens. Another factor is the treatment response. The response of tumors to treatment can also affect their growth. Some tumors may be resistant to certain therapies, leading to continued growth and progression. The development of resistance to treatment over time can allow tumors to continue to grow despite their initial response. Just as there are factors affecting tumor growth, there are genes that control cell growth and replication. These genes consist of genes like tumor suppressor genes, oncogenes, cell cycle regulators, DNA repair genes, growth factor receptors, telomerase genes, and those are just a few. When we think about genes such as tumor suppressor genes, how do they help control cell growth? Tumor suppressor genes regulate cell division and prevent the formation of tumors. They inhibit cell growth, promote cell death, they repair DNA damage, regulate the cell cycle progression. Some examples of those genes are the tumor suppressor gene TP53, the BRCA1, BRCA2, the PTEN. There are also genes that help to control cell growth, such as oncogenes. Oncogenes are genes that, when mutated or activated, they promote uncontrolled cell growth and division. They can stimulate cell proliferation, inhibit apoptosis, and promote angiogenesis. These genes include the HER2, the KRAS gene, the BRAF gene, and the EGFR. We also have genes like the growth factor receptors. Growth factor receptors are proteins on the cell surface that receive signals from growth factors, which are molecules that stimulate cell growth and division. Mutations or overexpression of growth factor receptors can lead to uncontrolled cell growth. Some examples of these genes are the EGFR, also known as the epidermal growth factor receptors. We also have the human epidermal growth factor receptor 2, which is the HER2, and the insulin-like growth factor, also known as the IGF-1R. These are just a few of the genes that help to control cell growth and replication. The transformation of normal cells into cancer cells involves a series of steps, referred to as cancer development process, or carcinogenesis. The steps include initiation, promotion, progression, and then metastasis. Initiation is the first step in carcinogenesis. It involves the introduction of genetic mutation or alterations in the DNA of normal cells. This can be caused by multiple or various factors such as tobacco smoke, radiation, or chemicals. This initiation leads to the formation of an initiated cell, which carries the initial genetic change, but it is not yet carcinogenic. Step 2 is promotion. This is where promoters are substances or conditions that stimulate the growth and division of the initiated cells. They can include things such as hormones, chronic inflammation, or certain dietary factors, or even environmental factors. Promotion leads to the expansion of the initiated cell population and the formation of a pre-neoplastic lesion or benign tumor. Step 3 is progression. In this step, it is where pre-neoplastic lesions or benign tumors acquire additional genetic alterations that confer them with malignant characteristics. These alterations can include mutations, chromosomal abnormalities, or changes in gene expression. Progression leads to the development of a malignant tumor, which has the ability to invade nearby tissues and potentially metastasize to distant sites. As mentioned in the previous slide, there are a host of environmental factors that can lead to cancer. Cancer can manifest in a variety of ways, and the specific clinical manifestations can vary depending on the type of cancer and the stage, as well as the affected organ or tissues. Manifestations can be categorized as local symptoms, where you may see lumps, mass, you can have pain, you can have changes in the size, shape, or color of moles, you can even have a persistent cough. Or it can be categorized as systemic symptoms. These are symptoms that affect the whole body and are often associated with advanced or metastatic cancer. These symptoms can include things like unexplained weight loss, fatigue, fever, night sweats, anemia, easy bruising, just to name a few. Or they can be categorized as paraneoplastic syndromes. This is where some cancers produce substances that cause symptoms in part of the body distant from the tumor site. These are known as paraneoplastic syndromes and can include things such as hormonal imbalances, neurological symptoms such as muscle weakness, difficulty walking, blood clotting, or skin changes. It is important to note that these clinical manifestations are not exclusive to cancer and can be caused by other conditions as well. However, if any of these symptoms persist or worsen, it is important to seek medical evaluation for proper diagnosis and appropriate management. The key to treatment of cancer is early detection and timely medical interventions. The next slide, let's talk about what are some of those diagnostic measures that will help to detect cancer. There are several diagnostic measures and tests that can be used to detect cancer. The specific tests vary depending on the type of cancer suspected, the individual's symptoms, and other factors. When we think about diagnostic testing, a step that is very important prior to ordering any diagnostic is to collect a comprehensive medical history and do an appropriate physical examination. A thorough medical history and physical examination is often important and the first step in cancer diagnosis. The healthcare provider will ask and should ask about symptoms, risk factors, family history of cancers, and then perform a physical examination and check for any abnormalities or signs of cancer. When we think about imaging tests, we use various technologies to create detailed images of the inside of the body. These tests help to detect tumors, determine their size, their location, and to determine if the cancer has spread. Common imaging tests we use are X-rays, computed tomographies or CT scans, magnetic resonance imaging, MRIs, or positron emission tomographies or PET scans, and even ultrasounds. When we think about laboratory tests, they can help detect certain substances or markers that may indicate the presence of cancer. An example of that is an alpha fetoprotein test. Blood tests measure the level of a certain substance, such as a tumor marker or specific protein that may be elevated in the presence of cancers. We also consider and utilize diagnostics such as biopsies. This involves the removal of a small sample of tissue or cell from a suspicious area. The sample is then examined under a microscope to look for cancer cells. Biopsies can be performed using various methods. There are needle biopsies, endoscopic biopsies, and surgical biopsies. There is also the use of genetic testing to identify specific genetic mutations or alterations that may increase the risk of developing certain types of cancers. These tests can be used for diagnostic purposes as well as to determine treatment options or assess the risk of cancer recurrence. Some of the screening tests that are utilized: observation, palpations, and even some laboratory tests. Screening tests are used to detect a cancer in individuals who do not have any symptoms. These tests typically recommended for certain types of cancers, such as breast cancer, where we do mammographies, or cervical cancer, where you do pap smears, colorectal cancers, where you do colonoscopies, or prostate cancers, where you may do biopsies. It is important that we look at diagnostic measures according to the individual circumstances and if cancer is suspected. The goal of cancer treatment can vary depending on several factors: the stage of a patient's cancer, what is that patient's overall health, and what are their treatment preferences. When you think about the general categories of the goal of cancer treatment, you think curative, which is to achieve a complete cure, eliminating the cancer from the patient's body and preventing its reoccurrence. It can be control, which is prolong the individual's life and manage the cancer as a chronic condition. Or it can be palliative, where you focus on improving the quality of life of the individual with advanced or incurable cancer. Now let's look at the diverse modalities used in cancer treatment. Cancer treatment should be individualized and based off of the type of cancer, the stage of cancer, and the desires of the patient. Cancer treatment is performed or managed by an oncologist. Although, as a primary care provider, you will not be treating cancer, it is important to understand the treatment that your patient may be undergoing. There are a diverse amount of modalities to treat cancers. It can range from surgery to radiation to chemotherapy and even some biotherapy. When we talk about treating cancer with surgery, we talk about surgeries such as cryosurgery, chemosurgery, laser surgery, or laparoscopic surgery. Cryosurgery is when you instill liquid nitrogen into the tumor through a probe. Chemotherapy is the use of a corrosive paste with multiple frozen sections to ensure complete removal of the tumor. Whereas laser surgery is the use of a laser beam to resect the tumor. And laparoscopic surgery is when you perform surgery through 2 small incisions and remove the tumor. Stem cell transplantation, also known as hematopoietic stem cell transplantation or bone marrow transplantation, is a medical procedure used to treat certain types of cancers. It involves the transplantation of healthy stem cells into a patient to replace damaged or diseased cells. There are several types of stem cell transplantations. They have autologous transplantation. This is when the patient's own stem cells are collected and stored before undergoing high-dose chemotherapy or radiation. After the treatment, the stored stem cells are infused back into the patient to help restore the blood, and immune system. There is also allogenic transplantation. This is when stem cells are obtained from a compatible donor. Typically, it's usually a sibling or unrelated donor. The donor stem cells are then infused into the patient after undergoing conditioning therapy. There is also synergetic transplantation. Synergetic transplantation involves the use of stem cells from an identical twin. Since they are genetically identical, there is no risk of rejection. So what are some of the indications for stem cell transplantation? It's primarily used to treat certain types of cancer such as leukemia, lymphoma, multiple myeloma, and some solid tumors. Radiation therapy is a common treatment modality for cancer that uses high energy radiation to kill cancer cells or shrink tumors. It is generally well tolerated. However, it does have some adverse effects. The specific adverse effects of radiation therapy varies depending on several factors. It includes which area is being treated, the dose of the radiation, and the individual's patient factors. Some common side effects that patients may experience include things such as fatigue, skin changes, hair loss, difficulty swallowing, diarrhea. Patients who receive radiation therapy may also get some late side effects. These may occur months or years after the radiation treatment. They include things such as fibrosis, radiation-induced secondary cancers, organ dysfunction, lymphedema, or even cognitive changes. It is important for the clinician to note that not every patient will experience these adverse symptoms, and the severity of the symptoms can vary. So providing supportive care and management is important for these patients. Also, having these patients participate in regular follow-up visits for monitoring and to help detect and manage any long-term effects that may occur as a result of radiation therapy is important. Let's talk about direct acting and indirect DNA interacting agents. Direct acting cancer agents are drugs that directly target cancer cells and inhibit their growth or kill them. Example of direct acting cancer agents include chemotherapy drugs like cisplatin, doxorubicin, paclitaxel. Indirect acting cancer agents, on the other hand, work by targeting other components or processes in the body that are necessary for cancer cell growth or survival. These agents do not directly kill cancer cells, but rather interfere with their ability to grow or spread. Some examples of indirect acting cancer agents include targeted therapies like tyrosine kinase inhibitors and hormone therapies. Classification of a cancer agent as direct acting or indirect acting can sometimes be subjective, as some drugs have both direct and indirect effects on cancer cells. Cell cycle cancer drugs are a type of chemotherapy medication that specifically target the processes involved in cell division and growth. These drugs work by interfering with the normal progression of the cell cycle, which is the series of events that occurs in a cell leading to its division and replication. There are different classes of cell cycle drugs that target different phases of the cell cycle. When we think about the anti-metabolites, these drugs interfere with the synthesis of DNA and RNA. They prevent cancer cells from replicating. There is also the meiotic inhibitors. These drugs disrupt the process of mitosis, which is the division of the cell nucleus. They prevent the formation of the spindle fibers that are necessary for proper chromosome separation during cell division. There is also the topoisomerase inhibitors. These drugs interfere with the action of enzymes called topoisomerase, which is involved in DNA replication and repair. They do this by inhibiting these enzymes. These drugs prevent cancer cells from dividing and replicating. There are also the cyclin-dependent kinase, or CDK, inhibitors. These drugs target specific proteins called cyclin-dependent kinases, which regulate the progression of the cell cycle. By inhibiting these kinases, the CDK inhibitors can halt the cell cycle and prevent cancer cells from dividing. Cell cycle cancer drugs are used to treat a various amount or types of cancers. They can be used for treating cancers like for the breast, the lungs, or even in leukemia. They are often used in combination with chemotherapy and it's part of a multimodal treatment approach. Now let's talk about biotherapy treatment. Also known as immunotherapy or targeted therapy. It's a type of treatment that uses substances derived from living organisms or synthetic versions of these substances to stimulate or enhance the body's immune system to fight cancer cells. These drugs work by targeting specific molecules or pathways involved in the growth and spread of cancer cells. There are several types of biotherapy cancer drugs. We have monoclonal antibodies, immune checkpoint inhibitors, adoptive cell therapy, cytokines, oncolytic viruses. Biotherapy cancer drugs have shown promising results in the treatment of various types of cancers. These cancers include melanoma, lung cancers, and certain types of leukemia and lymphomas. They are also often used in combination with other treatments such as chemotherapy or radiation therapy. The combination has proven to benefit the patient and improve their outcomes. Targeted cancer therapy, which is also referred to as precision medicine or personalized medicine, is a type of cancer treatment that specifically targets the unique characteristics of cancer cells while minimizing damage to healthy cells. It involves the use of drugs or other substances that interfere with specific molecules or pathways involved in the growth and survival of cancer cells. Targeted cancer therapy works by identifying specific genetic mutations, proteins, or other molecular markers that are present in cancer cells but not in normal cells. These markers can be used to select the most appropriate treatment for an individual patient based on the specific characteristics of that cancer. There are several types of targeted cancer therapy: small molecule inhibitors, monoclonal antibodies, and hormone therapies, gene expression modulators. Small molecule inhibitors. These drugs are designed to block the activity of specific molecules involved in cancer cell growth and survival. They can be taken orally and enter cells to target specific proteins or enzymes. Monoclonal antibodies. These drugs are designed to bind to specific proteins on the surface of the cancer cells, blocking their function or signaling pathways. They can also stimulate the immune system to attack cancer cells. Whereas hormone therapies, these treatments target hormone receptors that are involved in the growth and spread of certain types of cancers, such as breast and prostate. They block the effect of hormones or reduce their production. Gene expression modulators. These drugs target specific genes or gene products that are involved in cancer cell growth and survival. They can alter gene expression or inhibit the function of specific proteins. Target cancer therapy has revolutionized cancer treatment by providing more effective and less toxic options for patients. It allows for a more personalized approach to treatment based on the specific characteristics of an individual's cancer. Childhood cancers have several distinct characteristics compared to cancers that occur in adults. When we look at the incidence of childhood cancers are relatively rare compared to adults. They account for less than 1% of all cancer cases. However, childhood cancers are the leading cause of death from disease in children. When we think about the age distribution of cancers in childhood, it typically occurs in adolescents under the age of 20. The most common age of diagnosis, it varies between early childhood and adolescence. The types of cancer often seen in childhood are cancers such as leukemia, brain and central nervous system tumors, neuroblastoma, Wilms tumors, and lymphomas. Childhood cancers also have a genetic component to them. When we think about the growth rate of cancer in children or during childhood, children cancers or childhood cancers tend to grow and spread more quickly than adult cancers, which makes the prompt detection and treatment crucial to the success of their outcomes. So, how do children respond to treatment? Many childhood cancers are highly responsive to chemotherapy, radiation therapy, and surgery. Let's talk about some of the specific types of cancers that we see in childhood cancers. Neuroblastoma is a cancer that develops from immature nerve cells, typically in the adrenal gland. It occurs in nerve tissue along the spine, chest, and abdomen. Wilms tumors, also known as nephroblastoma, is a kidney cancer that primarily affects children. It usually occurs in children aged 3 to 4 years old and is rare in older children and adults. Osteosarcoma is a bone cancer. It commonly affects children and adolescents. It typically develops in their long bones, such as the arms and the legs. Ewing sarcoma is another type of bone cancer that primarily affects children and young adults. It arises in the bones of the pelvis, the chest walls, and the long bones. Retinoblastoma is the cancer that develops in the retina of the eye. It primarily affects young children and can lead to vision loss or eye removal if not treated promptly. Radiation therapy is a common treatment for childhood cancers, but it can have long-term effects on the health and well-being of survivors. Some of the potential long-term effects of radiation treatment in childhood include growth and development issues. Radiation therapy has been known to affect the growth and development of the bones and tissues in children. It could lead to stunted growth, skeletal abnormalities, and delayed puberty. Radiation can also impact the cognitive and neurocognitive system. Radiation has shown to impact the brain and the cognitive function of children. It can lead to learning disabilities, memory problems, and a decreased IQ. It also can impact the endocrine system. Radiation can damage the endocrine glands, which produce the hormones that regulate the various body functions, which results in hormone deficiencies such as thyroid dysfunction, growth, hormone deficiency, and early onset menopause. It can also impact the cardiovascular system, leading to coronary artery disease, heart valve abnormalities, and heart failure. Radiation also has the potential to lead to second cancers. While the radiation therapy is effective in treating the initial cancer, it may increase the risk of the child developing a secondary cancer later in life. Radiation has also been shown to impact a child's fertility, leading to infertility or an increased risk of pregnancy complications. Radiation can also impact the emotional and psychological aspect of a child. Children who undergo cancer or who are survivors may experience emotional and psychological challenges. These could include anxiety, depression, and post-traumatic stress. Long-term chemotherapy treatment in childhood can have various effects on the health and well-being of survivors. Some potential long-term effects of chemotherapy in childhood include neurocognitive effects, where the chemotherapy drug affects the developing brain and can lead to cognitive impairment and learning difficulties. It can also lead to growth and development issues, causing stunted growth, delayed puberty, and skeletal abnormalities. It can also impact the endocrine system and contribute to thyroid dysfunction, growth hormone deficiency, while also impacting the cardiovascular system and possibly leading to cardiomyopathies, heart failure, and heart valve abnormalities. Just as radiation therapy, chemotherapy can have the long-term impact on childhood fertility issues and lead to an increased risk for secondary cancers. This concludes my lecture on neoplasia, benign versus malignant tumors. Now the next few slides will allow you an opportunity to do a knowledge check. You will have several questions, and the preceding slides will have the answers so that you can assess your knowledge, and if needed, you can go back to your textbook and enhance your understanding of the information that was discussed in this lecture.